We're at the second day of FMCC, Florida Medical Conference, in Orlando, Florida. And we're talking about patient access to care mainly, and how medical cannabis is really the future to help in a lot of different ways as far as pain management is concerned, and to really educate doctors and others who are interested in medical cannabis. And with us today is Terel Newton, Dr. Terel Newton. He's the medical director for Trulieve, who is the premier supplier of medical cannabis within the state. Has over 100 locations, 130?
We're about 137, 138 in that range.
Yeah, you never know what they could open up tomorrow, so, we have a problem. You're not sure. So tell me a little bit about yourself and how you got into this and why cannabis?
Yeah, absolutely. Thank you, Charles, for having me. And this is the 7th year I've attended and spoken at the Florida Medical Cannabis Conference and Expo. And it's just been an amazing experience. Every year it seems to get better and better. And we're finding new and more applications for the medical cannabis for different types of pain and mental health. This month we have PTSD Awareness Month and also Cancer Survivors Awareness. So there's so many different applications where you can apply cannabis. And this is a great forum for collaborating with some of the top doctors in the state and around the world on educating about cannabis. Some physicians that are published, some physicians that actually write journal articles, and most of the doctors here do recommendations here in Florida. So they're really kind of, boots on the ground physicians working with patients, really trying to help them get more relief with less medications and really help increase the safety for patients dealing with a lot of conditions.
Right. I mean, it's been proven over the years that using a regimen of cannabis, medical cannabis to call it that, is much better for a patient, whether you be an infant or whether you be somebody who's 90 years old, rather than taking the prescription drugs or opioids for pain. And that has just been proven over and over again. And sometimes I think you need to take a baseball bat and hit somebody over the head to make them understand that. But, sometimes they just don't want to understand that at all. So with that, we've sat through some sessions. You've been involved in 2 of the sessions. In fact, you led one session yesterday. And you're really preaching to a crowd here that is all for it. But it's amazing how the doctors that are here, and now, there are probably 75 to 100 doctors that are here that are practiced. I think their main practice, the only thing they practice, is really cannabis medicine. How do you, in teaching them or giving them up-to-date information on what's going on, how does that work for you? How does that make you feel to be able to do something like that, to help them educate?
Well, it's a tremendous honor. And one of the great things that we covered yesterday, so I went into some of the history of how we discovered our body's cannabis.
Right.
So we actually have an endocannabinoid system. So we have this in our body, and most of the research has been done in Israel. And that's in part because we've had a restriction in the United States with THC being Schedule 1. We can't study it for medicinal benefit, but we know that there's benefit because it's been used for thousands of years.
Right.
In the early 1900s, physicians actually could prescribe cannabis, and it was often mixed with other medications to get a synergistic benefit. And of course, we went through a period of prohibition where we could no longer prescribe cannabis, and then over time, the states have seen that patients really can benefit from this medicine, and they're having serious conditions. So that's where we have grown and developed as a country, more and more states allowing it for their patients that's dealing with serious conditions. And now we're looking at and on the verge of having it rescheduled. And so once that happens, then we can put more funding into research. We can learn a little bit more about how different types of cannabis helps with different types of pain. We can continue to develop and make progress in that. And meeting with physicians that's here doing recommendations and providing them updates on some of the current research studies that's being done, it's something that helps us all basically get up to speed. And so cannabis is currently being studied for anti-aging, for pain management, also for different anxiety disorders, and also for pediatric pain conditions and for cancer conditions. So not just
sleep also.
Insomnia is a big factor. It's a big thing that where patients can benefit.
Right.
And one thing about insomnia is that patients can have it related to pain, so they're waking up in pain, or they're very anxious. And so cannabis is unique in that it can often treat more than one condition at the same time.
Absolutely, and that's the beauty of the medicine, and we're really kind of on the early stages of what cannabis can really do for somebody. And again, moving the scheduling, and it's been go from the FDA to the DEA now, and there's an open period of what I've just heard today, 45 more days to put in your suggestions or reasons or comments they call it comments relating to it. But I think it's going to be rescheduled. And once it's rescheduled to Schedule 3, it changes the industry totally. Totally changes the industry.
It really opens things up and makes it much more easier. And I know there's a lot of physicians, even here today at this conference, that want to do research, that have great study designs in mind. And then once we get that change, it'd be much easier to implement those strategies, to have clinical trials, to have different types of study design where we can look at different qualified conditions.
And there has been, a couple of doctors have taken it upon themselves through some of the universities to try to do some studies.
Absolutely.
The problem is it's limited because you can't really use product in the studies, because it's illegal to be able to do that. So once it changes, I think you're going to see this new old medicine becoming the product when dispensed correctly to really solve a lot of problems, that are out there, and not have to rely just on the pharmaceuticals that are very, very expensive, have a lot of side effects that you don't want, to a medicine that really can benefit you by not only ailing pain, but helping your body in general.
For a number of years before I was the medical director here at Trulieve, I was giving recommendations for patients. And I was amazed at how patients can wean off of not just opiates, but benzodiazepines, that's like anxiety medicines like Valium, wean down on nerve pain medications, NSAIDs like ibuprofen, naproxen, that can often damage the stomach and cause ulcers. So the overall safety profile actually extends beyond just opiates. And there's tremendous benefit that we can do. And patients can't overdose on this medicine. They can't. There's no overdose deaths related to the medication. I'm not saying that there's no side effects, but the safety profile is tremendous. And there's something called a therapeutic window, and that's the difference between where somebody can take a dose and they should take a lethal dose. And so there's no known lethal dosage of cannabis that patients can take. And we really need that today, because there's still many patients dying on a daily basis related to the opioid epidemic. And there's literally an exponential increase in opioid-related deaths, and that's in part due to synthetic opioids like fentanyl. And a lot of that fentanyl is not even prescribed. It's brought into the U.S. in forms of fentanyl or carfentanil. And keep in mind, this is a medicine that's 100 times stronger than morphine. And there's another version of that medicine that's 100 times stronger than fentanyl called carfentanil. So
and that's coming in. It's just coming in and people not even knowing they're taking it. And that's the problem.
It's smuggled in under the radar.
That's right.
It's not like where you have like bricks of medicine, bricks of cocaine being smuggled in. This is small, like sugar packet size of products, and it can be snuck in much more easily because it's so very potent. And then they dilute it once it's here in the United States.
And the other issue you have with what people will say, with the product, I can buy some other products off market that will be just as good. And the reality of it is, buying from when this program was set up in the state of Florida, and there are currently 22 dispensaries out there, if people understood what the dispensaries have to go through, from creating the product, to processing the product, to putting the product on the shelves and selling it, they go through a rigorous situation that most pharmaceutical companies have to go through. There's no difference. But the stuff that's out there that you see in the head shops, in the 7-Elevens, that are saying, well, there's substitutes and cheaper and you don't need... Nobody can tell you, and I don't care who they are, what's in that bottle or what's in that gummy that you're buying. And that's the danger. And when you see a problem and people and you see the news people saying, well, it's a cannabis problem, you're talking about not the cannabis coming from dispensaries. You're talking about the cannabis product coming off of the shelves in head shops or in gas stations that have not gone through the testing and the checkpoints that the dispensaries have.
Yeah. There's been a few studies that has looked at this. The CBD in over-the-counter hemp products can often be 60% mislabeled.
Right.
To where they say there's no THC, but THC is in there. They say they have less than 0.3% THC, but then you have a synthetic THC that's actually in there that can often be much more dangerous. And if this gets in the hands of children or even a medically sensitive adult who's dealing with some different pain conditions, balance problems. Not only that, some of the products can have organophosphates, so pesticides can all be in that as well, because like you said, there's no testing standards, but here in Florida, the medicine is sent to a third party for testing to make sure that there's no heavy metals, there's no pesticides, there's no fungal contaminants or other type of mycobacteria or anything like that, and then it's also tested for the accuracy on the label, that there is the amount of CBD, that there is the amount of THC that's there listed on the product.
And you as a consumer can actually check that, because each product that comes through a batch has to have a QR code on it that you can actually hit the QR code, go to the website, and see the current testing that was done just on that batch that you're buying. I mean, so it's a pharmaceutical grade product, and that's what people truly don't understand. So the next topic that is very interesting that we need to talk about, because it relates to the state and what's coming up now in November for the election, and that is the idea of making this an adult use state. So can you tell us what an adult use state is?
Yeah, so what we have right now is a medical program. Adult use just basically opens up to where a patient can go into a retail store and make a purchase without having their card and the qualified conditions. And in a lot of cases where you see adult use, I'll give you one example: athletics. And so that's one avenue where a lot of athletes may be dealing with and trying to prevent inflammation, for example. Another use is for wellness. So maybe a patient doesn't have a specific qualified conditions, but they know that there's health benefits from the plant extracts in the cannabis. And so that really kind of opened things up for patients. It actually gives a lot more flexibility, in the adult use setting. And you may see patients still taking the cannabis for a medical reason, even though they're under adult use, in which case you'll start to see different individuals get coaching and recommendations through nurses, through other professionals that's knowledgeable in cannabis. But overall, it basically opens things up to where there's more accessibility for the cannabis products.
And it gives the ability of a person to try a product, and there'll be differences in the product. Nobody knows. People think there'll be some differences in it. There'll be, if it follows suit as other states do, medical in the state of Florida is a non-taxable situation. Whether you're buying an RX over the counter in a drugstore or a pharmacy, or you're buying a cannabis product, it's a medical product, there's no tax on it. If it goes to adult use, if it follows everything else that's happening in other states, it will be taxed. And it will be taxed, I mean, if you take a look at some of the other states, it could be taxed as much as 16%, 20%, you never know. So if you become, and it tried and it works for you, you're going to wind up getting your medical card, because it'll be a cheaper product. There may be some other benefits. We were talking today, just hypothetically, you may have a fast pass line where if you got 20, 30 people in line waiting for it, if you have a medical card, you go to the front of the line to be able to get the product. Nobody knows. Those are just hypotheticals. But the idea is, it's better for the state, it's better for the population. What people don't understand, you don't have to use it. It's like anything else. It's like a liquor store. It's like a tobacco product. It could be there, you could see it. Nobody's forcing you to buy it. You're going to have to be over 21, okay? But if you want it, it's available. And that's the whole point is, why not? And, if somebody can say, well, well, it just shouldn't be out there. Well, tobacco shouldn't be out there sometimes. And how much liquor is out there? I can go out there and buy a case of liquor and drink the whole thing in the parking lot, okay?
Absolutely.
And who's stopping me? But that's okay. Okay? So why not give the ability for those, and this is more of a medicine for people, to try? And Trulieve is ready to step up to the plate to be able to serve both adult use and medical.
Yeah, absolutely. We always will prioritize the medical patients that need it for serious conditions, but having it also available, like it is in some other states, for adult use is an excellent time in the cannabis industry, and it'll allow much more flexibility for the constituents of Florida, and so it's an exciting time. Something to look forward to.
And people also, if they have the ability to do this, instead of buying a product that is not tested, sitting in a head shop, they can now go to a truly tested product and know that they're getting a tested product that is pure. Whereas before, if they wanted to try something, they're really relegated to go to someplace and they're not sure what they're buying. So it really works out well for everybody if you're out there and you're listening to this, vote yes on Amendment 3. And there's no negatives to it, only positives for the state of Florida. So with that, I think that'll be it. We had another session coming up. This is kind of the end of the day, the second day. There's a half day tomorrow. If you're in the Orlando area, stop by. They got a nice exhibit hall with some people here that with products relating to it. You can talk to the Trulieve people one-on-one, talk about their products. They have no samples. Don't look for samples, but they do have packages that can tell you about their products and educate you about their products. So if you are around the Orlando area and you want to stop by the Rosen Center Hotel, now's the time to do it.
Absolutely.
Dr. Newton, I appreciate it.
Appreciate you.
Thank you. And we'll see you next time.